Last time we discussed about the antibiotic that will disrupt the cell wall synthesis. Next, we discuss about the folic acid metabolism. Uh, in this in this metabolism, I think not much people know the folic acid mean. Folic acid is a kind of used to synthesize purine and thymidine monophosphate. Uh, that means the lack of this kind of chemical will lead to the lack of purine and thymidine. Purine uh, that will lead to a disruption of DNA synthesis. That means not much. The DNA will not be synthesized because lack of material. The folic acid uh, has a large requirement for the pregnancy population that they usually require around 600 microgram a day and used to produce hemoglobin L uh, or other that for the babies for the embryo. But alcohol and uh, methotrexate will denature the folic acid. So the pregnant people will never want to drink alcohol. But the disruption of folic acid metabolism pathway will also a way to disrupt uh, inhibit the growth of bacteria like trimethoprim and sulfonamides. This antibiotic will uh, use the mechanism to disrupt folic acid metabolism to inhibit growth of bacteria and other like cytoplasmic membrane structure to disrupt the membrane structure and cause substance leakage from the membrane, which is known as a well, not very known. I never heard this kind of antibiotic before. It's said polymyxin and diptomycin. Well, there is some antibiotic exist has this kind of mechanism, and some other mechanism that inhibit two types of topoisomerase. Topoisomerase that I know. Topoisomerase is a process of circular DNA that replicate after replicating need topoisomerase to separate two molecules. In the process of DNA replication, it will uh, release a supercoiled DNA molecule. It mainly in gram-negative pathogens, so mainly and topoisomerase 4 mainly in gram-positive bacteria. Uh, Another like DNA elongation, RNA elongation. RNA elongation is about. I think it's about mRNA formation. The example is actomycin D is used to target GC-rich region on DNA and able to block and disrupt the function of RNA polymerase. That means block the mRNA formation, disrupt the uh, transcription process. Another one is DNA-directed RNA polymerase. The example is rifampin. It used to treat TB, tuberculosis, and it inhibits RNA polymerase because TB is in a rest state and do not produce the cell wall. So uh, the method to disrupt the formation of cell wall will have no effect with TBs. So this drug, uh, this is a good drug, and because it is have no side effect with the pregnant woman, so take it will have a red sweat, means you have some you tears or sweat will be red, have red liquid, even have red urine, and should in the process of this antibiotic will need to cut the alcohol and require use of combination with other drugs because it is easy to get resistant. This drug is very easy to get resistant, and it has a drug-drug interaction like warfarin, Acton, and Valicin HIV treatments, especially protease inhibitory methadone. If we have HIV patient want to treat HIV first and use rifampicin, which is the analog but has less conflict with the HIV treatment. Uh, Another example is protein synthesis. That is antibiotic that affect the 50S ribosome. The example is erythromycin, chloromycinical, clindamycin, lincomycin. This antibiotic will bind to either 50S or 30S to disrupt the protein synthesis. Uh, and the protein synthesis uh, in this the tRNA also involved. To disrupt the tRNA has mopirocin and puromycin antibiotics. I think this information is enough. And for another detail is about topolymerase 4, which is I want to add some more information. The antibiotic called corneline is a class of antibiotic and able to be modified in different side chains. There are 8 side chains able to be modified and able to function in either DNA grades or topolymerase 4 nucleic acid cycle. So means that class of antibiotic are either able to target DNA grades or topolymerase 4 but have a similar chemical structure.